Cervical cancer is the 11th most common cancer in women. Under 35 is the top cancer, but despite lots of campaigning, 1 in 3 women in the UK are still not coming for their cervical screening.
I'm Dr. Alex Gawthrope, and here in our practice in sunny Blackpool, we have seen a dip in the patients coming for cervical screening. So if there's one thing you want to take away from this message, I'm calling on everyone who has a cervix, women, trans men, non-binary people with a cervix. If you're not up to date with cervical screening, please contact your GP surgery, get an appointment with the nurse, let's get it done. We hear a lot, oh, the doctor's surgery is too busy, I don't want to bother them. So if that's you, forget that. No, we want people to get cervical screening done, and we'd much rather be doing that than have people develop cervical cancer that may have been preventable. So, pick up the phone, book online. Our surgery at Newton Drive has nurse clinics running every week for cervical screening. Similar goes in our area for Leighton Medical Centre, Martin Medical Centre. There are even evening appointments and weekend appointments in Blackpool for cervical screening in case you need to fit it in around busy lifestyles. Many sexual health clinics run cervical screening services too. To do it today and get it booked in, it might be life-saving. Sounds dramatic, but it is absolutely true. Now, if you don't have a cervix, are your loved ones up to date with cervical screening? Sometimes we find that partners and family are the most important people in raising awareness of cervical screening. I had to remind my wife for months. She kept putting it off as she didn't feel comfortable doing it. And I get it, most people don't fancy the idea of a stranger looking at your bits.
But when I did finally get it done, I did need treatment, and the NHS has potentially stopped me from getting cervical cancer.
So that's the main take-home message. And if that's all you're going to take away from this video, you're up to date with cervical screening, or you're going to get in touch with your GP, absolutely fine. We can stop there. But if you are on the fence, let me give you a little bit more detail. Let's talk about what the test is, why it's important. We'll talk about HPV or the human papillomavirus, and also what happens after you've had the test.